driving a wave of suicides and depression. The hard-hitting findings of new research into austerity. After a policy of painful cuts, a study casts light on the devastating social impact. This is Inside Story. Hello and welcome to the program. I'm Rida Fakhri. It's a term that's become synonymous with spending cuts and tax increases, economic pain and suffering. Austerity, strict measures to rein in government debt, opinion on the success or otherwise of this policy remains deeply divided. But new research is now suggesting it is taking a devastating toll on the health and well-being of millions of people across Europe and North America. The joint British and US research says more than 10,000 suicides have been recorded during what they call the Great Recession. And as many as 1 million cases of depression have been diagnosed. That's a rise of 10%. It says 5 million Americans have lost access to health care. 10,000 families in Britain have lost their homes. HIV rates in Greece have risen by more than 200% since 2011 because of cuts in funding. And the research suggests rising unemployment is pushing more young people to take drugs. Let's look now at both sides of the debate surrounding the socio-economic impact of austerity with our guest from Oxford in the UK, David Stuckler, co-author of the research and book, The Body Economic, Why Austerity Kills. In Athens, Aris Sisouras from the Institute of Social Policy in Greece. And here in Doha, George Kratsas, an economist and specialist on EU regulations. David Stuckler, you say austerity is having a devastating effect on health in Europe and North America. Just how compelling is the evidence that austerity measures have been, as your study puts it, seriously bad for people's health?
We've been studying recessions and large economic shocks over the past century with a focus on the present crisis. And what we found is that while recessions pose risks to health, it's austerity that can turn them lethal. In the worst case in Europe, we've seen Greece, where austerity is breeding a series of public health disasters. For example, after its mosquito spraying prevention programs were cut, the country experienced a return of malaria, which it had kept under control for 4 decades. HIV infections have jumped by 200% since 2011, linked with cuts to drug prevention programs and HIV treatment campaigns. Across Europe, we see rising suicides concentrated in the countries that have cut the most public sector jobs. And these are just a few of the many harms we see from austerity.
But how strong, how unequivocal is the evidence that it is austerity that is responsible for all these ills, for driving suicide and depression rates, for the spread of HIV and other diseases, and that it isn't, in fact, simply the economic condition that people live with and the high unemployment?
That's a good question. One example comes from Iceland, which, after all 3 of its biggest banks failed, suffered the worst banking crisis recorded in history. Debt jumped to 800% of GDP, 8 times its entire economy. And yet the country's people voted against austerity measures, instead boosting supports to its universal health care system. No one lost access to care, and in fact, the society became healthier in some surprising counterintuitive ways. Road traffic deaths fell as people drove less during the recession, and even people turned to eating more fish. So this society, once the happiest nation in the world by the UN, in 2011 was again rated as the happiest society in the world.
George Kratsas, are these policies then, austerity measures that include these significant spending cuts, responsible for what we are seeing? Are they to blame for much of society's ills? Are they costing too much on a human level?
Well, thank you for your question. Austerity is unnecessarily evil as long as it's applied with a purpose. Now, although I do agree that austerity has an intense social cost, it must be pointed out that the budget cuts that are being proposed and the ones that are being imposed are aimed to have the least possible impact on the healthcare sector. And they're more on, or let's say, on the quality of the healthcare that Greek citizens receive, and they're more directed to address waste. Now, I do agree that in realistic terms it's very difficult to impose such severe budget cuts without affecting the quality of the healthcare that is provided in Greece. But at the same time, it must be acknowledged that many of the measures that are currently being proposed by the Troika to Greece are seen, if you look at them, you'll realize that many of them are directed to the right direction. For example, What is being proposed is to impose a proper pricing on medicines. Medicines have not been priced properly the past few years. That's leading to severe losses for public hospitals. Others are negotiating better prices between Greek hospitals and pharmaceutical companies.
Well, you say these measures are going in the right direction for Greece, but we've seen an increase in the number of suicides in Greece. Greece has gone from having the smallest numbers of suicide within the EU to the highest. How do you explain that?
Well, the main question regarding the effects of the social cost of austerity is that austerity is not necessarily always a direct consequence, or let's say the social cost is not always a direct consequence of austerity. Austerity is in many cases only the tip of the iceberg. For instance, loss of employment is very often associated with unhealthy lifestyle, intense emotional distress, and bad nutrition and substance abuse. So this must be taken into account when we're discussing the wider debate about the effects of austerity on society.
Aris Sousouras, you have worked within the health system of Greece for quite a while, so you know it better than anyone else. How profound have the negative impacts of austerity been on the health and well-being of the Greek people?
Well, I don't know what more I can say, because both our previous friends, I think they covered almost all the issues. Professor Staker, of course, he considered it because we have to look at the effects of the austerity on these two sides. First, on the health status and behavioral effects like the suicide, like depression and so forth. But I want to bring and put the things into perspective. Greece, as Portugal and Ireland, they are under the pressures of a special memorandum, which is dictated by the Troika, the IMF, the European Union and the European Bank. And this Troika directs all its measures, I would say, towards fiscal cost containment. And what I want to bring into the picture, whether against in inverted commas or without inverted commas, these austerity policies which are imposed especially upon us through this memorandum, we can introduce the kind of reforms and the kind of structural changes that the health systems need in order to, on one side, not to resist, but to be more efficient and to rationalize on the cost allocation and the use of cost and so forth and so forth. And this is the thing which is missing somehow.
So what is missing? What is missing, you say, is real structural change. David Stuckler, how responsible then is the IMF for these policies, for these conditions, the strings attached that it puts on some of these countries to enact all these spending cuts, privatization policies and so on?
Yes, the price of austerity can be calculated in human lives. We've known in European public health that there were long-standing issues in the Greek health system, and there are some very good proposals by health experts for how to deal with them. Unfortunately, the program to redesign the health system was not developed by doctors, but by many economists who have little or less knowledge of the healthcare system. It's like having someone try to redesign your car, but has no experience being a car mechanic. So what we've seen is many of the proposals, for example, to bring health spending to below 6% of GDP by massive cuts to the pharmaceutical bill, have had unintended consequences that have led to stockouts of more than 200 essential medicines, as the state was no longer able to afford to pay pharmaceutical bills. We've seen healthcare access drop by 50%. The majority in pensioners, over 60,000 pensioners in Greece, we've estimated, have been stripped of access to health care. The EU has a treaty obligation to evaluate the health impacts of its economic policies, and so far that has yet to happen.
And as we've been saying, the International Monetary Fund, one of the main promoters of these austerity policies, has been largely uncompromising in its stand on austerity. Its managing director, Christine Lagarde, told Greeks last year not to expect any sympathy. She said, quote, "I think more of the little kids from a school in a little village in Niger who get teaching 2 hours a day, sharing one chair for 3 of them. They need even more help than the people in Athens. As far as Athens is concerned, I also think about all those people who are trying to escape tax all the time. They should also help themselves collectively by all paying their tax." But now there are signs of a softening stance. José Manuel Barroso, President of the European Commission, says the focus on austerity has hit, quote, "the limit of public acceptance." He said, socially and politically, one policy that is only seen as austerity is, of course, not sustainable. We haven't done everything right. The policy has reached its limits because it has to have a minimum of political and social support. George Kratsas, are politicians now beginning to see the light, beginning to understand the negative impact of their policies, or are they largely still living in denial?
I think the question is that we must bring in certain economic factors in the discussion, that it's undeniable that Greece has suffered some immense social cost. And I do agree in principle with your other guests on their discoveries and all their statements. However, we need to bring into the discussion certain important economic factors. Is that Greece, for the first time in decades, in the last 2 quarters, has been recording a primary surplus. This is something we would never have been able to achieve had it not been for the greater rescue package. Now, effectively, some part of these funds will be able to be allocated to the healthcare sector, which might not have been possible before. We also need to point out a few other developments, that Greek bond spreads are dropping, many investors are returning to Greece. They are fleeing away. Greece's credit rating is improving, and more importantly, unemployment is getting under control. It's not dropping yet, but at least it is stabilizing, which is a very important fact. It's a recent development and needs to be put in the discussion of the greater impact of the rescue package.
Aris Sisouras, do you agree? Has the austerity measures, in fact, provided some measure of benefit for the people, that they need to be perhaps a little bit more patient to see the full level of benefit that could still come out of this?
Well, if I heard you, because although I am under the inspiration of the Acropolis, but Athens is very noisy and I cannot hear all the argument in a way. But I wanted to add that this memorandum mechanism, which is very important, you know, for examining the effects of crisis on the health care, they don't measure somehow, they don't assess this type of implications. So, as a trade-off, to provide measures also and suggestions and proposals in order to counter these bad effects. And this is our argument at the moment. And as you said, or I said at the beginning, part of the memorandum was to form a task force to suggest certain reforms which will, in long term or even in medium term, we provide this type of changes and structures which will assure the cost containment which is now imposed through certain measures. It's not nobody's taken into attention. And I think you must realize, for example, Greece is one of the only country in Europe that we don't have a well-organized network of primary health care services. We don't have a network of general practitioners. We don't have a reference system. So patients are fishing around, in inverted commas, excuse me for the word, fishing around, you know, for services either in the private sector or in the hospital. They are paying out of pocket money, and so forth and so forth. I mean, these are basic notions and basic reforms which the austerity measures does not consider it at all, but looks only what we can save from cutting down from drugs, from cutting down or if you like, co-payment. We didn't mention, you know, that Greece at the moment, through this memorandum, is looking very much at this increase of the co-payment percentages from the citizens, either to drugs or services and other things. So these are policies which they have to be looked again within this austerity and find another paradigm, if you like, of what we call austerity.
David Stuckler, then, how do you deal with the problem? How do you contain the social fallout from these austerity measures? Is it up to each and every country to enact its own policies, or is it really up to organizations like the IMF to be less cruel, quote unquote, in its approach to some of these problems?
These are enormous human costs. I would point out austerity in health is a false economy. Cuts to disease budgets and the health problems we see are going to cost much more to try to cure and stop than they would have been to prevent. In our work, we found that each euro invested in public health systems spurs the economy by more than €3 because it translates into job creation and provides vital services that protect the nation's health. So it can not only help protect people in hard times, but spur economic recovery. And across Europe, we've seen that the economies that have invested more in public health and social protections have been lifted out of their recessions faster.
George Kratas, the IMF admitted, in fact, in its World Economic Outlook that it had underestimated the negative impact of some of the policies it has advocated. Should politicians then take into account some of the socioeconomic repercussions of their policies, not just look at the bottom line and the money that they can help these countries make in order to repay their debts?
Surely, having correct economic figures is certainly important, but sometimes the discussion over the effects or the magnitude of certain numbers sometimes distract us from the real issues, which are tackling the long-term problems, the long-term failures of the healthcare sector and the Greek system as a whole. For instance, with regard to healthcare, I'll be much more concerned to hear about tackling waste, in establishing a proper electronic prescription system and controlling the amount of drugs prescribed by doctors, imposing harsher penalties on doctors who violate the rules at the cost of public hospitals and the Greek citizens. I think this is where the entire rescue package is heading to. And despite the medium to short-term negative effects, I am confident that we are a few months, 6 months or a year before seeing the true positive effects.
But the reality though is, as it stands, that government-funded programs that are most often cut are education, healthcare services, those that are in deep need of investment, of restructuring, of improvement, and that are underfunded to begin with. Is this where the answer lies, or does it end up hurting the people of Greece and other European countries and North American countries more than it benefits the economy?
It is true. It's unfortunately because there's been too much a focus on budget cuts from the very beginning, as opposed to making economic reforms that would have been more beneficial, that would have already been impacting, having their positive impact felt by the Greek population. But look at other cases. Greece has been an extreme example. Ireland soon might be coming out to and receiving loans from the debt capital markets rather than the Troika. Portugal might be following soon. I should point out that there is a greater measure of stability felt around these countries. No one is really talking about Greece exiting the euro anymore. No one's discussing about Greece defaulting. These are necessary steps we need to follow. Unfortunately, we need to feel the harsh effects of austerity in the meanwhile, but it's a necessary step.
But
as I said in the beginning,
evil, you say, but still a lot of protests, a lot of anger on the streets in many different capitals. David Stuckler, is there a real alternative, though, to these tough choices that politicians are making? Is there the potential for a new kind of New Deal, something along the lines of what was enacted back in the 1930s in the United States, where you look both at the economic recovery of the country, but also the nation's recovery as well?
Absolutely. Let me just first say, had we organized austerity like we would any drug trial, given potential for health risks, given the evidence we now have of deadly side effects, it would have been discontinued. What we see from our histories of past recessions and now present ones is that there is an alternative. The Marshall Plan after World War II in Germany paved the way for the reconstruction of the social security system that led to prosperity. At a time of debt being 200% of GDP in the UK, Britain founded the welfare state. It didn't break the bank. It led debts to fall in half within a decade. And similarly, in the New Deal, a time of greater hardship than today in the 1930s, Great Depression period in the U.S., Roosevelt boosted financial relief to the unemployed, saved people from homelessness, invested in public hospitals, schools, and it helped put the economy back on track.
And in the U.S., as you say, the focus was on relief, recovery and reform. Aris Tsitsouras, should there be more focus today on relief of the most vulnerable groups within society, the unemployed, the uninsured, the migrants?
Exactly. Exactly. I mean, that's the sections of the society that are suffering more. And you know, if you look at the self-assessment of health, you can see now this section of society, they say how bad their health is. But we must really focus on this issue which was discussed before, that austerity versus economic growth. For example, in the health system, what happens in Greece? We have followed, and I am one of the policy analysts which I say that some of these austerity measures have established a window of opportunity in order to make very important changes and reforms into the healthcare system, like the one that was mentioned before, like electronic prescription, introducing DRGs for rationalizing on the costing, and so many other things which they have to be really developed. But we made a major reform. We organized an organization, we developed an organization for delivery and finance of the healthcare services with the target to develop the primary healthcare services and rationalize the financing of the system. But now this organization, which is its budget, it should be formed by the insurance funds and the insurance network, because of the recession, because of the very high recession, the contributions are very low. So we are into this vicious circle.
So how do we get out of this vicious circle? George Kratsas, forgive me for interrupting you. Just in a minute left to us, it was presented by a lot of European leaders as the only solution. Has austerity, though, lived up to the expectations of creating fiscal consolidation, or has it been, as many people would argue, self-defeating? Has it been worth the pain it has inflicted on so many?
First of all, on whether austerity is the only solution, it needs to be acknowledged that the entire rescue package is not decided unilaterally by Greece, or even simply with the contribution of the Greece and the Troika, but it's also dependent very much on the politics in different countries, in Greece's EU partners, politics in Germany. The upcoming elections in Germany might have an important factor to play on this, on the development of the Greek package. So this will be very interesting to observe in the next few months. Now, whether it has brought about the needed, the desired tax fiscal discipline, progressively it is having a positive impact on people's mentality and on how people observe their obligations towards the state.
Still much room for debate, but we'll have to leave our discussion there. Let me thank all our guests, David Stuckler, Aris Tsitsouras and George Kratsas. And thank you for joining us on this edition of Inside Story. You can, of course, send us your feedback by emailing us at insidestory@aljazeera.net. From me, Rida Fakhri, and the team, thanks for watching.